Thank you for joining us, everybody. We're super excited to have you here. We're super excited to bring this community Q&A to everybody. We're going to do an info session followed by a question and answer. And before we get started, we have muted everybody and we've stopped video, and that was on purpose, just because we want to record this and we'll put it up. It's just a little bit easier to follow if there's not a lot of background noise and video happening. So thanks for keeping it this way through the video. But today we're going to talk about what is functional medicine, and we're going to go into how can it benefit you or somebody that you know to live a healthier life. So we'll do the info part of it, then we'll get into the Q&A part of it. If you do want to submit a question, we would love it. And we have that chat button via Zoom. That is something that you can submit a question and I'll be monitoring that. And at the end, we'll get to that. If we don't get to everybody's questions today, we'll make sure that we put a cute, like the question, then the answer on our Facebook page within the week so you can have an answer to your question. So just start, Heather's gonna do an introduction for us, and then she's just gonna jump right into it.
Well, again, thank you everyone for joining us. Again, as Lindsay said, we are very excited to bring this community Q&A to everyone. I want to start just by introducing the Montana Functional Health team. I'm Dr. Heather Maddox, co-founder of MFH, and of course I'm joined by Lindsay Peterson, also co-founder of Montana Functional Health, as well as Heidi Moretti, registered dietitian and founder of the Healthy RD, and finally Carla Alpert, registered or certified health coach and founder of Well Humans. I want to start by taking just a few minutes to explain what is functional medicine, because it's certainly a question that I often get asked. Functional medicine really is a nice blend of the best of conventional medicine with traditional natural therapies. It's very similar to integrative medicine, but it takes a more systems-oriented approach, and it also really tries to identify the root cause of why someone has a symptom or an illness. I want to explain a little bit more about what a symptoms-oriented approach is. You know, our body is very complex, and we are composed of multiple organs and systems. You know, for example, if you think about our digestive system, it's not just your stomach or intestinal tract. It's working together as a whole. Our immune system, which we're going to be talking quite a bit about, of course, these next few weeks, is comprised of multiple organs, but everything's very interconnected. Everything's talking to each other. The gut-brain connection is an interesting area of interest right now. We know the brain obviously has its own nervous system, but so does the gut, and they're constantly talking to each other. And it's interesting, we're learning more now that our mood may be actually more controlled by gut bacteria and how that's interacting with our brain than our brain itself. To me, what really makes functional medicine stand out is this wanting to identify the root cause of illness. A good example of this is irritable bowel syndrome. It's very common. It consists of various symptoms like constipation, diarrhea, abdominal pain. But you can have two people with essentially the same symptoms, but totally different causes. In fact, it's thought that about 10 different things can cause irritable bowel. So what we're really trying to do is find what is the why, what is the cause for that particular person, rather than just treating the symptoms. When you think about combining the systems-oriented approach and understanding a little more of how the body works, plus this trying to identify root cause, it really allows for a more personalized approach. You're not just treating the disease, you're treating the individual. When you're putting all of this together, you can really come up with a very individualized plan. It's based on your health goals, your needs, again, this root cause, and really trying to, treat as best we can. It's not a cookie cutter approach. It's not a standard protocol approach. It really is trying to individualize it as much as possible. I've been in practice for about 17 years now in primary care, and just recently left my position at Western Montana Clinic. And I was really struggling with burnout over the past 3 years, and a big reason for that was I felt like people were coming in with more complex issues that I was struggling to manage. Often, of course, prescriptions, as helpful as they are, sometimes they're just not the answer. In fact, towards the end, I felt like that's all I was doing, was writing lots of prescriptions, sometimes 40 or 50 a day. And again, can be very helpful, but when people were coming in with more complex issues, or if the prescription or the medication didn't help, or side effects were occurring, sometimes I felt like I was a bit lost with what to do next. And I went into medicine to help people. And again, prescriptions can be part of that, but I felt like I just wasn't helping people as well as I wanted to. When I went to my first functional medicine conference 3 years ago, it absolutely ignited the fire and the passion back into practice. And when you start learning about more how the body works, and this individualized approach and finding root cause, those to me provided the answers that I really needed, those extra tools in my toolkit to really start to help people heal. And which is, again, why I went into medicine in the first place. So it really, functional medicine is a new lens to be able to look at chronic disease and help heal people. And with that, I'd like to turn the floor over to Lindsay to talk a little bit more about what functional medicine has to offer.
Yeah, so thanks, Heather. That was awesome. I think that gives a good overview of what functional medicine is. I felt similar to Heather, and I've been in practice for about 6 years. I've worked at the urgent care for that long. And, while urgent care, I really like urgent care because it's interesting that conventional medicine works really well there. If you break your hand, we can fix that. We can take an x-ray, we can splint it. If you need stitches or sutures, we can do that. There's various other things we can do that really do bandage you up right away. So conventional medicine works well there. But what I would find is in between those types of visits, we would also get people who had, maybe they'd come in and they'd say, oh, I've had GI problems for the last, 2 years. And really these are quick 15-minute visits at the urgent care, and I didn't have the tools to help them. So, we would talk about it and try to figure out what they could do, but they were seeing their primary care provider, they were seeing their specialists, and they really weren't getting anywhere. And this was happening more and more, that these people would come in, and I just really felt lost as a provider that I couldn't help them or figure out a path for them. So I think that along with that, and then my own personal health issues, I really ended up finding functional medicine and falling in love with it, because just the whole gist of the way you think as a functional medicine trained provider, you really get back to treating the person as a whole, like Heather was talking about. And I think one really big thing that we think about as functional medicine goes is it's not a new modality, it's not a new specialty, it's a new way of thinking, and really about chronic disease. So how do we get sick, and then how do we get well? And while medicine should be thinking of that in general, it's just tough under the conventional realm and in the business realm that it just sort of takes over production value, trying to see patients within 20 to 30 minutes. You just don't get that time. And functional medicine really allows that time. You spend an hour to an hour and a half with patients, really getting to know them and their history, their timeline of how did their disease started, when their symptoms came on. And we dig in a little bit deeper, and we go for that root cause. And one big thing that we find a lot in the root cause way of thinking is that lifestyle is a big contributor. So what we'll see is that people's lifestyles, just for one way or another, whether they're overstressed, they're not sleeping the way they should, maybe they're eating a poor diet, maybe they're actually eating a good diet, but they're eating things that they're allergic to or their body isn't responding well to. So they're ending up with quite a bit of inflammation and just imbalances through the system. So what we do when we first work with patients is we really assess that lifestyle and see if there's anything we can change there. Often we find that there is. And then when we make those improvements, it's been pretty impressive. We can see usually 50 to 75% improvement within a matter of weeks. And so we'll start there, and then we move on, obviously, and try to get to more roots that we find. So we really do take the whole person approach. We end up going kind of over the whole system, like Heather was talking about, it's a system approach. So we kind of dive into everything. And what we've realized when Heather and I were starting this business is that it's just too much to take on as just providers. So we ended up looking into functional medicine further at their team approach. And a lot of that functional medicine, one of the concepts, I guess, of it is to use a team to really hit all aspects of patient care. So that's when we ended up looking for a dietitian and meeting up with Heidi, and then looking for a health coach and meeting with Carla. And those two are really integral parts along with the provider in the functional medicine care model, because it really helps people create healthy habits and realistic routines so that people can live healthier lives. It gives multiple touch points so the patient can be kind of worked with in multiple areas and angles so that everything gets addressed so that they can move forward with, again, these healthy habits and realistic routines. So with that, I am going to let Heidi talk just about what she does, and then eventually Carla as well, kind of what she does and how that can really address patient care and make improvements for the patient.
Yeah, thanks, Lindsay and Heather. And I mean, it's been great to meet people who have like-minded ideas about eating, lifestyle, and just getting to the root cause of illness. And I come from 20 years of working in clinical care, and what's really been, rewarding about functional medicine is that it's not just you have IBS, here's your diet. It's a very individualized approach with food. And I feel like it's with functional medicine, we really take on and look at research in the ways that it was meant to be. Like, and being a nutrition researcher too, throughout my career, I know there's so many studies that just never see the light of day with health, or especially with food nutrition, things like that. And that was really tragic to me to see that. And when I attended functional medicine probably 5 years ago, the first conference, it was like I came home, for the first time, and it changed my life. It changed how I eat every day. It changed how I practice. And I think, I love to share the excitement, because when I feel good and feel the best in my 40s that I have in my whole life, I love to share that with people. And and many people realize that food is a lot more than just food. It's information in our bodies, and it's healing, and it can either promote inflammation or it can reduce inflammation, depending on your genetics and depending on how you grew up, and your whole life story plays into where you are today. So I think I love that about functional medicine is we really look at someone's history and find what meal plan works for them as an individual today, what it'll look like in 5 days, maybe 5 years. It's going to be different, through the spectrum of your life. And when you, like Heather said, when you get to the root causes, you're talking about being able to help your sleep, your energy, digestive issues are really at the core. Energy, of course, immunity, as we will get into a lot of in the future. So super exciting. The field of functional medicine is really, really invigorating as a practitioner, as a person who has dealt with health issues and has healed from some of these issues myself. And as a dietitian, we are able to, do more than just you have heart disease, give you this diet. It's a individual therapeutic relationship that, we hope to develop with each and every person we meet. So I feel like functional medicine and functional nutrition really, of course, are where the way of the future. And I feel super grateful to be part of the team and the approach we're taking here today. And that lifestyle part that can be tied all together, the stress and all those things, and that Carla here is an expert in, and we love having health coaches, because they can pull everything that we do together and in a way that's meaningful to the individual. So with that, Carla, you want to tell them a little about yourself and what you're doing?
Sure. Thanks, Heidi. Hi, everyone. Just like Heather and Lindsay and Heidi, I also have a personal story that led me to functional medicine and healing. And it was so liberating to find out that I was not just a diagnosis, and that it was actually possible to heal my body just by implementing different lifestyle changes that supported my health. But I also know firsthand how overwhelming it can be to make these changes. And I also know what it's like to do everything that it takes, all the lifestyle changes, and then finally feel healthy again. And this is the reason that I am so passionate about functional medicine and why I actually became a health and wellness coach in the first place. So I'm here to help you put all the moving parts together on your journey. And I often find that most people, they know what they need to do to be healthy, but they have a hard time actually doing it. For example, you might have your recommendations from Heather and Lindsay and Heidi, but you don't exactly know where to start or how to sustain them. And this is where I can come in. I'm a good hand holder. I can hold your hand every step of the way as you work towards reaching your goals. And I'm also able to offer you tools and resources when you start to make the changes. And Health coaches help motivate you and provide accountability. They celebrate your successes, they encourage you, and enjoy your progress. And I'm not only here to guide you through dietary changes and food plans, but I can also help you with stress reduction and relaxation and movement. And I know that making lasting lifestyle changes is not just a switch of the flip, that it takes a lot of effort and support. And I would be honored to support you on your way to healing. So now I'm going to give the screen back to Lindsay, and I think we're going to start the Q&A.
Thank you, guys. So I can take questions through the chat button, and then we'll just direct them to who they need to go to. But if you guys want to submit, please go ahead and submit through the chat button, and I will be kind of monitoring that right now. And we did get some questions that came through email, so I can start with that just to get us going. So one of the questions that came through that I wrote down was, if I work with your team, do I still need my primary care provider and my specialists? Heather, do you want to answer this one?
Yes, and so it is very important. In fact, it is going to be a requirement that people still do have that primary care physician. I think there's still a huge role that a primary care physician can play. You know, certainly for insurance reasons, you know, a lot of the time you can get a physical annual wellness visit covered, get labs done. Certainly if, you know, one thing we want to make sure we're doing is, you know, going through the proper channels of workup. So like to say, if there is a digestive issue, especially if it's been on for a while, you may very well need to have had some imaging done, maybe even endoscopy. It's important that those things can still get done if needed, and it's really necessary to have a primary care physician to do that. Certainly people may still need to have a specialist as well. You know, again, taking a digestive issue as an example, certainly if someone has Crohn's disease or something more serious, they are still going to have a specialist involved. We are not trying to replace either of those things. Really, we want to work in tandem and collegially with people's primary care physicians and specialists. You know, we're not meant to replace them, but really to work together. And like I say, we're trying to blend the best of conventional medicine with natural therapies.
Perfect. And then we did just get another question that came in. And is there testing that you do for digestive health? Heather, I think you can answer this one too, and I'll jump in with you.
So again, you know, and sometimes we can do this as ourselves, but certainly let's say if you do have a primary care physician, I mean, there's some just basic blood work that's necessary. But definitely one thing that we can do that to me is a step further is to really dive into more digestive function. You know, this is a rapidly growing field. Things are changing all the time. And there are several companies that we use, Doctors Data for one, that does a much more comprehensive kind of GI profile. And it really looks into the diversity of gut bacteria, how they're functioning, if there's an imbalance, if there's something that absolutely shouldn't be there, and gets a lot more into function. Sometimes lab work, traditional lab work, doesn't really tell you a lot about function. It just tells you is, you know, something elevated or abnormal. But again, to me, the testing that we can do, especially with digestive health in the functional medicine world, gets more into that root cause, that function, rather than just sometimes identifying something that's abnormal and not really understanding the cause. And it also really allows for us to get to customize these plans, you know, based on what we find.
Yep, perfect. And then, you know, there's other things we like to do that maybe indirect testing for digestive health. So we like to test different foods with people. So we'll put people often through different, like if it's an elimination diet, something, if that's what they're needing, we'll put them through that. And it is really a test of itself, and it's nice because it's free. But it does take some time, but luckily we have a team to work with patients. But we end up doing that test because it really does show what is bothering the patient. So what if we just we eat every so many hours in a day, and we eat over and over again, it's really hard to pick out the thing that's bugging us. So when we go through an elimination diet, we're able to do an elimination phase and then do a reintroduction phase, which will allow us to slowly bring things back in, and then the patient can monitor symptoms, which allows them to say, look, yeah, that, you know, we give a list of symptoms because they say X really gave me a headache, or I ate this and I felt fatigued. And there can be different symptoms out there that can show that someone's reacting to a certain food, and it may not just be specific to digestive specific problems like bloating or gas, even though often we find that as well. So Hopefully that answered your question. And if you do want to ask more detailed on that, please feel free. Okay, here's another one. I just need to find that. So do you find pain referrals, musculoskeletal pain are related to digestive issues or other functional medicine issues? It's a good question.
That's a very good question. And again, I can kind of start with that. So definitely, and again, it just depends, but that's certainly something we would look at. You know, oftentimes musculoskeletal pain can be due to chronic inflammation. And a lot of times that chronic inflammation can start with an imbalance in the digestive tract and how that interacts with the immune system. Again, that's one thing we're going to get into a lot more in these next few weeks is, of course, the function of the immune system, but there's such a close, tight relationship to the gut. And so sometimes it can be chronic low-grade inflammation that the gut and the immune system have started up with each other that in some people can present as musculoskeletal pain. Sometimes also too, we see there's a lack of something, maybe a lack, especially with muscles. Muscles, you know, burn up a lot of energy. They require lots of different minerals and vitamins to do that. And unfortunately, we're seeing more, even when people eat healthy, more mineral deficiencies and vitamin deficiencies. And so sometimes that's playing a role as well. So again, that's what's so great about functional medicine is we can really just look at the whole body and put it all together. And it may be that there are multiple systems involved in causing pain.
And I can kind of speak to that personally because so I did my own functional medicine journey. And what happened with that is I ended up doing the elimination diet and finding that, so gluten is my big trigger. I actually do have some level of celiac going on. So before that though, I had absolutely no idea what I was eating and that it could even be food. And I was having migraine headaches. I was also having really severe right shoulder pain and neck pain. And I had no idea that it was related to food. Until I started to do my own research, be my own advocate, get out of just the conventional medicine world and try to look beyond that kind of thing and really look into what else could be causing this. And that is when I found functional medicine and when it made sense to me that there are things that we can do that just you may not think makes sense at first, but once you dive into it, it really does make a lot of sense. I cut out gluten a year and a half ago and I haven't had a migraine since. So I don't have any of the shoulder pain. I was going to chiropractors and massage therapists and acupuncturists and I mean, just spending endless amounts of money trying to figure out how to adjust my musculoskeletal system so that I could feel better. And I'm in my 30s. So it just was really alarming to me that when I had increased stress, I would get these severe headaches. And I thought, well, maybe I'm just living a stressful lifestyle. And that was part of it. But really, it was this whole picture of me not realizing that it was something I was consuming on a regular basis. Even though I thought my diet was pretty healthy, I was eating something that my body did not like. And it took that elimination diet for me to really figure that out. And man, the change that I have seen, it's incredible. And I feel so much better. And this is pretty much why I wanted to get into this, to help people figure out their triggers for why they aren't feeling good. So hopefully that example is at least helpful. Okay, and then there's another question that came in. Will you be accepting all types of insurances if we would like to refer people your way? So I'll start with that one. So currently we are not accepting insurance. We are a cash pay fee for service. And the issue with that is really just the way the insurance companies run things. It's sad and unfortunate, but insurance companies require specific things to be able to cover, and they're not looking at functional medicine right now as something that they're covering. And really it's because of how much time we spend with the patient. Like I was saying earlier, we'll spend an hour to an hour and a half with people, just really getting to know them. And it takes that much time to dive into things and identify these causes that we're talking about. So there's really no way for us to bill insurance and then get reimbursed so that we can actually practice. And so it's really sad and unfortunate in that realm, but we try to get through people through our program efficiently and effectively as possible so that when they're paying cash, they're feeling like they are really investing that money into their health and getting a lot out of it so they can get those future habits and routines in place so they kind of know how to take care of themselves if things perk back up in the future.
And Lindsay, I might add, I'm not a doctor, but I feel like functional medicine has saved me in terms of like so many healthcare dollars overall. Just it's such a value that it's hard to put a number on. And just, like I'm thinking about pain, about the question about pain and, nutrient deficiencies were playing into some of my pain issues, so, and of course some of the foods, but I just thought I'd add that because I thought, it's an important thing to bring up is the value and the long-term value, really.
Totally, Heidi. Yeah.
Mm-hmm.
Thank you. And that's a super good point, because it really is that investment in health, so that you can feel better doing the things that you love to do and doing them, in the long run, long term. So.
And I do want to add, we are able to generate super bills and that people can submit to insurance to try to get coverage. So that's certainly something we can do as well. And people can also use health savings account dollars as well as flex dollars as well.
And then another question is, what kind of lab work do you end up ordering?
I can kind of jump into that. It really can be very, a wide range of things. I think certainly some of the common things we'll do that's maybe a little bit different than typical lab work is definitely, like we're talking about before, getting into more of a comprehensive GI type of testing. We also look a lot at adrenal function and hormone function again, and adrenal function is rarely, if ever, tested in conventional medicine. And that's a big part of functional medicine. There's certainly fatigue and is a common symptom we see. Hormone imbalances, so there's a really called a Dutch test, a very detailed look at those types of things. And we could do a more detailed thyroid panel than usually what it's done. Definitely look into a lot more mineral and vitamin deficiencies. There's tests you can do to look at that in, like I said, a lot more detail. How the parts of your body called mitochondria, what produce energy in your cells. You can look at tests that look into that. So there, you can look at toxins, you can look at heavy metals. So there's many, many types of different things we can do. We try not to, we also try to be very cost conscious and do the things that make the most sense to do, but certainly there's a wide range of tests you can dive into.
Yeah, that's a perfect overview. And like Heather said, we do try to start with basic stuff at the beginning, lifestyle change. If there are tests that we need to rule out because certain symptoms are there, then we love to do those at the beginning, just so we know that's just to know which way to go, I guess, with the patient. But if we don't need the information, we certainly don't go there. And sometimes if we just make some big changes and some lifestyle changes back to diet and stress reduction, when we start there, we'll often see people improve so quickly that, maybe we still need to hit some things and dive into some tests. But again, we do try to be cost conscious of that to make sure that we're not, adding these tests on to the price unnecessarily. We're only doing it if we really need to. So, and then another question that came in is it possible to work with you remotely if we don't live in Montana?
Well, I can jump in. Yeah, the beauty now, of course, of telehealth, and actually the electronic medical record system we use does offer that. Certainly is allowing for that now to happen. We are able to do telehealth visits. Sometimes I think just phone calls can be very effective as well. I think in the first couple of visits, it's nice to, be able to see someone in person if possible. But again, things are changing, evolving. We're certainly willing to change with the times as well. And certainly I think there's a huge role for telemedicine, which does allow for us to work with someone remotely.
Yeah, and what's super fun is Carla is working remotely with all of our patients. She's in New York and is just tapping in with patients. She'll do a phone call with them and yeah, work with them however they want to work with. But you can talk a little bit about that, how you do it, Carla, if you want to.
Yeah, sure. Whenever I work with my clients, it's always remote, as Lindsay said, and it's actually very effective. People have gotten great results, not having to be in person, and we can still go through protocols and lab results and different sort of, food changes and habit changes and sleep routines, all by phone. And I've seen a lot of the clients have really great success.
Awesome. And then what about another question that came in via the email earlier was, what conditions do you treat? And I think Heather started kind of talking on this when she was going over the some of the tests that we do. But really, we go into some heavy hitters. We really dive into fatigue. There's a lot of times we'll hear people feel chronically fatigued. So we'll address things that may cause that. We dive into thyroid. There can be a lot of underlying thyroid issues. It's just kind of a finicky organ, but a lot of things can affect the thyroid. So we try to find things that are affecting the thyroid, and some of the lab tests will show us if the thyroid is underactive or overactive. So we can dive into that. Again, we do the digestive issues. We do address, like I said, for me earlier, migraines and headaches, other pain issues there. There's, a lot of things we'll find will affect hormones. So again, it's an upstream effect. So we'll go downstream and look at adrenal function, and we'll look at diet and thyroid, and then often that will help then rebalance hormones. So we can look at some hormone things that people have going on. What am I forgetting, Heather? I know there's a whole list.
Yeah, so one thing, back to kind of the systems approach, you start to realize there's a lot, and people can present with multiple different symptoms, but the cause is pretty similar. And so it allows you to really manage a wide range of things that seem complex and seem totally unrelated in a much, more straightforward way. So autoimmune disease is, to me, functional medicine plays a huge role in autoimmune disease, and that encompasses probably over 100 different things. But most common, like thyroid disease, can be very commonly autoimmune. But rheumatoid arthritis, psoriasis, Crohn's disease, multiple sclerosis. I mean, again, some of these things, obviously, people are still going to need specialists, but there's a role for functional medicine to play. Certainly in the realm of autoimmune disease, chronic pain, I know we've kind of addressed already as well. Yeah, skin conditions, allergies. Of course, we've talked a lot about food sensitivities. So there's really, just about, on some level, anything that functional medicine can at least try to address. I don't think there's really anything that we would leave out.
Yeah, and one big other point is just healthy aging. How to age gracefully and healthy is another big thing, because we can all work on that. So
cardiovascular disease and diabetes, I forgot to mention that as well.
Yep, all the cardiometabolic issues that are really plaguing our country right now, and causing, even when we look at the coronavirus right now, the people who are suffering from cardiometabolic disease are the ones who are really suffering from being affected more harshly by COVID-19. So those are things that we like to say, well, look, there's these outlying illnesses like COVID-19 that come up, and we want people's bodies to be in a healthier position to be able to take on, if they did get a virus like that, to take on, take it on and just be able to get through it in a healthier manner. And then another question that came through earlier was, do you see children? And on that one, just to answer it, we aren't seeing them right now. There is a place for functional medicine with children. Since we're a brand new business, we're starting with 18 and older. So we're starting with adult patients. And eventually we hope that we can dive into more kid issues, because it does start, maybe things start at a young age. We would love to be able to hit it at that young age, just to set them up for a healthier future. But currently right now, just with where we're at, we're gonna just start with adults only, just for right now. But we'll be updating that as soon as we feel like, yep, we can dive into the pediatric realm. And one last question that we have, if there's any more, we can get to them, but one last question that I see is, what does a typical functional medicine visit or health journey look like? Do you want to dive into this one, Heather?
Yeah, I can go ahead and dive in. So definitely if we're doing something more chronic, by default, those types of things have been going on for a long time. And so one thing that's a little bit different with functional medicine is that, we have set this up to be something that we're going to be working with you over the period of time. Ideally, though, we have tried to set it up to be as efficient and effective as possible, because a lot of people have already put a lot of money into things or been dealing with something for a long time. But what we have found is that for many things, a 4-month structure works really well. We start with a 20-minute complimentary phone call just to kind of get an idea of the person's concerns and how we can help. And then we have a pretty structured setup with provider visits, dietary visits, and then working with Carla, at certain intervals to really, again, try to maximize success as quickly as possible. And again, one thing we found is that symptoms, like Lindsay mentioned this earlier, really do improve very quickly. But sometimes the more deeper imbalances do take longer. And so we found that, and again, this is, the whole idea is personalized here, so it certainly can be adjusted. But as a rule, starting with a good 4-month structure has worked out really well.
Yep. Yeah, and I think again, like Heather said, we do the 20-minute call. We try to see kind of what the health goals are, what the overall concern is, make sure that functional medicine is a good fit for what the concerns are. And then we have a first visit that we work with patients on, just kind of getting to know them better, diving deeper into the health goals, looking at their needs, desires, and maybe talk a little bit about what they've already done so far, just so we get a grasp of how far has their journey come to date. And then from there, at that visit, we explain kind of what we think would be the best path for the person. Because again, like Heather and all of us have mentioned so many times, is it's personalized. So it really is about you. And we want to make sure that the path moving forward, whether it's a 4-month, if that makes sense, or if it makes sense to go longer or shorter, that we do it knowing kind of the gist of what's going on. And we talk about it at that visit so that we can then pick a path and just move forward with it and have people dive into working with us, working with Carla, working with Heidi if they need to. And so really it really starts at that first visit and knowing what to recommend to the patient. And then I guess it could be a good time for us to talk, Heather, about that acute visit that we're just adding now, if you want to talk about it.
So we, certainly in the setting right now of COVID-19, but just in general, cold and flu season, we are offering a 30-minute virtual visit to get into more acute concerns and see if we can come up with a personalized immune boosting plan or protocol.
So we have that on our website. And if you guys haven't checked out the website, it's mfhcare.com. And so the website has the 20-minute call. So again, that's for more chronic conditions. And then it has on the homepage, there's a button there to get started if you want to do a acute visit. And that's really just if you're having more acute issues. And again, like Heather said, we try to put together an immune boosting protocol that can help just during this time right now, just help make sure that you're staying healthy and doing everything that you can to keep yourself in a good state of health. So yeah, that's kind of the couple things that we're really offering right now, but we feel like it kind of hits the spectrum of a lot of what people need. So it's been nice to kind of come up with those visits and try to figure out how we can be well-rounded for everybody. Yeah, and I think that's it. Does anybody have any more questions? I think that's all that we ended up getting through the email, and then the ones that are on the chat right now. So we'll just take another couple seconds. If you have another question, put it through. If you don't, that's fine. I think it is about time to wrap up anyway. And so Heather, do you want to tell them about what we're doing in the next few weeks?
Yeah, and so certainly starting next week, we're going to dive much more into the immune system, how it functions normally, and really the key influencers that can affect it, and especially can create imbalances. So we're going to at least do some introductions next week into how gut health plays a role, diet, we've certainly talked a lot about already, sleep, exercise, movement, stress, community health. And so next week we'll talk a lot more about the immune system in general, and then we're going to really in weeks 3 through 6 get into more again how diet affects the immune system, how stress affects the immune system, and again how ways that it can cause imbalances, but then obviously ways to right the ship, so to speak, and have those things be a positive and not a negative.
Yep, exactly. And then I guess at the end, so we'd love it if you come back and come watch us in the next few weeks and ask any questions that you have related to the topic that we're talking about. And if you did see the invite that came through, it does give you the weekly sessions over the next 5 weeks and what we're going to talk about. And then if you do want to check us out further, again, the website is mfhcare.com, and the Instagram handle, we have an Instagram page and we have a Facebook page, and those are both at MFH Care. So check us out there. And we also would love it if you wanted to sign up for the newsletter, because we offer a free healthy dining guide. It's all about Missoula restaurants, which is a little crazy right now because a lot of them are closed, but we've adjusted it to be a takeout version. So if you're looking for, if you have a long day and you want to order out, it may be a good resource for you, because it can give you kind of good ideas of what is considered healthy. We had Heidi, our dietitian, go through it and kind of look at things and pick some meals out that she thought looked good. And yeah, there's just a lot of good ideas on there. And then we're going to put through some recipes. And I'm actually going to in the works of creating a gut health guide that we're all going to be working on too. That'll be free. So these things will all come through the newsletter, and we'll just have lots of other good information for you. So it might be a good resource for you to look at that. And that's just on our website, so you can check that out. Well, thank you guys so much for coming. So we're going to be back in a week from today, and we'll dive right into some of the key influencers in the immune system. So please join us again. Thank you guys so much.
Great.
Thanks
Thank
for your
you.
awesome questions.
Thank you.
Thank you.
Bye.